Good morning, everyone, on this foggy, rainy morning. This is the Price County Health and Human Services Board meeting. I call this meeting to order. I'm Paula Hodak. I chair this committee. And if we could have the roll call, please, Meredith.
Thank you. Good morning. Joe Baraka, Paula Hodak,
Here.
Robert Kopish, Patricia Stephen, Dennis Worko, Nicole Kulwicki, Sally Hummel is excused, Suzanne Ucker, and Gerald Swenson. Thank you.
Thank you. You did hear from Sally then, huh? Okay. Okay. We'll check in with her. I worry that we don't hear from her. Okay, let's go on to public comment. Is there anyone here for public comment? There's a sign up. Hi, Pete.
I'd like to make a public.
All right. I didn't see, did you sign up on that? Okay, I'm sorry, I didn't get that sheet. Yep, the little button. It'll turn green,
Turn like that, okay.
and then you'll need the microphone up. Thank you.
I came here today to thank the county board and the citizens of Price County for allowing me to be part of the public health effort in Price County for over 40 years. I didn't realize that my last Board of Health meeting would be my last. But I want to appreciate the 40 years that I've been supportive of the Public Health Department as their advisor and on the Board of Public Health. And I would like to also say that I think the support of public health is more important now than ever, since we're not getting any good advice from the nationally or from the CDC anymore. That the state and the local health departments have to really take an effort to be part of supporting public health and keeping us healthy and safe. And that's all I really wanted to say. I just wanted to be on the record that I'm appreciative. Thank you.
Well, thank you, Pete. Your service was really very, it was very cohesive in that you are from our neighborhood, our community.
Yeah.
And to me, that spoke volumes of how you would portray our county and that you would support all of us. And we appreciated your service on this board for 40 years. Wow.
Well,
That's commendable.
about 82 or 83, my mother trapped me into being her advisor. And I've been here ever since.
Mothers do those things.
Yeah.
Well, we thank you again. And we hope you enjoy the rest of your retirement.
I'm not retired. I'm self-unemployed.
Okay. That's a wonderful thing to think. Thank you so much. Take care. Okay. Any communications from the board here? Anyone? No? Anyone online? *6. Nobody? All right. Well, seeing and hearing none, we'll move on then. Thank you. Vouchers. Oh, gosh, they're here. I'm sorry. They didn't even get going. Hold on. I'm sure. I did look them over, but
Got 2 meetings to make up for.
Disappointed last time, you kind of let me down here.
I'm gonna let you down again.
yes,
Yeah.
to Joe, please.
I looked at them and there's
Nothing?
nothing unusual in there. It seems like same old, same old.
Okay, that's
So,
what I was thinking.
Unless you
but-
have some things you want to highlight,
No.
point out before we sign them. No? Okay.
I told Sarah everything looked about normal, so.
Well, if there are no other questions, although you didn't get to sign it, you should have had it online if you could have read it there. So no other questions for Chris Ann? Okay. Yep, good job.
I
Thanks,
had nothing to do
Chris-Ann.
with it, but-
And as soon as we'll come back to that for approval. Let's go to the minutes of the August 13th meeting. What is your pleasure?
I make the motion we accept minutes from last.
Motion from Mr. Swenson,
I'll second.
second from Susie Ocker. Any discussion? Hearing and seeing none. We'll call for the vote. All those in favor? Those opposed? Okay, motion carries. And let's go to the annual report. You were given a draft of this at the last meeting, so you should have had plenty of time to read it and go through the whole thing. So We'll have each of the managers come up and just give a brief description. No, they're not going to read it verbatim. Hopefully you've done that yourself. But if you have questions for any one of them, please make sure that you ask them when they're up here. So I'm going to have Sarah talk and call each of them up.
Carrie, you want to come up first and talk about the revenues and expenditures?
Okay, I think too, Sarah, you wrote a beautiful letter too to introduce and starting it off. So this year I kind of changed up the format of the revenues and expenditures. You know, sometimes you got to start I don't know, change it up a little bit. So first part we kind of just broke it out by the expenditures and the revenues. And then the types of revenues that came in, and then the personnel and operational costs. And then the next couple pages just outline it based by unit and what was budgeted, and then where we kind of ended up at the end of the year. Does anyone have any questions? Perfect.
Thank you, Carrie.
Okay, next we'll have Chana on behavioral health.
Hello, everyone.
Morning.
Same reporting programs as last year. So CSP varies as usual with enrollment, and we stay right around 20. We're actually kind of low right now. I think we're at like 16, which isn't a bad thing for that program. CCS, last year we enrolled 7 people. We had 23 referrals. And again, sometimes when we get referrals, either somebody doesn't qualify or they later decide they don't want services. So that doesn't mean that we didn't try or anything. It just means that at some point it didn't work out. Currently our CCS program is really growing, and we have an enrollment that's getting close to 25 or 30. So, CST, Coordinated Services Team, that's the wraparound program for kids. And we're staying right within the same numbers, right around 9 or 10 kids in that program. Intensive Supervision Program is the OWI offense program. Not a lot. We had 10 people last year, and currently I think we only have 1 enrolled. And that program only lasts about 3-4 months. But not necessarily a bad thing, although sometimes people maybe should enroll and don't. So, but that's a voluntary program. So, mental health crisis service, the calls were down from the year before, which is good. And we're doing, now that I have a full team starting last year, we're doing a really good job with follow-up and then getting people to possibly consider other programs so that we don't have further crisis in the future. Targeted case management, that's just a program that we use possibly to bring in some revenue if it's somebody who has medical assistance and they need some extra services, but maybe don't qualify for CSP. We didn't have anybody in that program in 2024. I think we've had at least 1 this year. We may have more in the future. Children's long-term support services, that program continues to grow. 51 children served. I do believe the caseload for children's waiver right now is right around 56 or so, possibly higher. So that program is really booming, and there isn't a possibility of a wait list, so we have to find a way to make those cases work. Birth to 3, there were 9 children served last year, 20 children referred. That's another program where they're screened, so possibly they didn't meet requirements or the family decided, yeah, we'll kind of wait it out and see if things change for the child. And that's it. Does anybody have any questions about any of that? Okay.
Thank you, Chana. Thank you.
Okay, the next is economic support, and Jenny Shu is not here today, but if anybody had any questions, Steve Budnick, who is from the Northern Income Maintenance, consortium administrator. He would be more than willing to answer any questions if anybody had anything for economic support.
Any question? Hmm.
Okay. Any questions? Okay, next would be public health. Tiffany?
Hi, our annual report portion, is broken down by our public health services. The first portion being our foundational areas. So those are the areas that, and the programs that are kind of, encompass everything that we do, what is required of public health. And then the foundational capabilities is how we support that work. So to break that down, our communicable disease control, that's when, we receive, reportable diseases. We do the disease investigation and follow up with contact tracing. You can see the breakdown of each of those diseases there, which is pretty consistent with previous years. It also includes our tick-borne, which is the vector-borne diseases, and any mosquito-derived diseases. HIV prevention and partner services. We provide services for a range of the counties, and we do follow up for that. Those numbers are consistent with the previous year. And then most people know us for immunizations. And those numbers are listed there. Looking at chronic disease and injury prevention, we have our Price County Health and Wellness Coalition and our Price County AOD and Mental Health Coalition. Both are very active in events in the community. You can see the breakdown here of events they provided, services they provided, working with the school districts or with other departments, units, or other organizations. Going forth into the Northwoods Tobacco Free Coalition, that is, Oneida County has the main grant for that. We partner with them and provide some of the Escape the Vape and other education that goes along with that. And one of the newer ones that we had was the Partnerships for Success. We might also hear that we reference as our alcohol grant. And Susie Daniels has been busy working on that. She worked on it beginning in 2024, and that's continuing. Environmental health, we continue ahead in 2024 and continue to provide these same services. Numbers were pretty consistent with previous years. For our maternal child health, we still offer the health check program where they're well child visits. We're basically trying to just fill in the gaps of kids that aren't getting into primary care providers. School health plans, we work directly with the Phillips and Prentice school districts on providing health plans for children with special health care needs, and also support the Schwamigan School District as needed, but their school nurse provides the health plans for that school. Prenatal care coordination, that is one of our programs that we work with pregnant moms in the area, mostly those that are at high risk, to help them take stressors off of them, provide education, provide some case management, so that they can focus on having a healthy pregnancy and overall with the hope for a healthy birth. From there, we then, you may see us talk about targeted case management. And that is where we can enroll those children into a case management program from those pregnant moms, and help support them as they grow and make sure that they're getting hitting those milestones, and then supporting them through their childhood years. Reproductive health continues to be a pretty big program for us. Numbers here are consistent with previous years. WIC is probably one of our main ones, and you could see the breakdown of that here. They provide help for pregnant, breastfeeding, and postpartum women, as well as infants and younger children. And down below, you could see some of the breakdown of that. Again, that targeted case management. Other nursing services that we provide are also listed there. And then on the next pages is just a little bit more breakdown of some of those foundational capabilities that we are providing, other community supports, partnerships, and what we are doing to maintain our emergency preparedness plans, our communications with the community in order to make all those other services happen. Any questions?
Thank you.
Okay, next is Aging and Disability and Senior Services. So we'll have Chris Maybe and Don Griesel.
Hi, everyone. So the Aging and Disability Unit, Senior Services units are on the first page. It lists all of the programs that we administer to serve the residents of Price County. So you can see it's a number of programs. So what we're going to go through is just briefly talk about each of the programs. So Chris is going to go first and talk about Senior Services.
Hello. So we have the Elderly and Disabled Transportation Program. You can see here that we had 7 volunteer drivers in 2024. And then it lists out the volunteer hours, the driver trips, and the total number of miles that they drove. We also have the Bay Area Rural Transit, BART. There we listed how many stops Park Falls route had and the Phillips route, along with Minocqua at the bottom. Strong Bodies information on the next page. We offer Strong Bodies in Catawba, Ogama, Park Falls, Phillips, and Brentwood, and virtual option. Senior Nutrition Services, we have the 5 dining sites, Park Falls, Phillips, Kennon, Ogama, and Brentwood. At the bottom, it lists out how many congregate meals were served along with home delivered meals for 2024. Any questions?
Could I ask?
Well,
Madam Chair,
Sure, Brian.
on BART, it's got stops listed. Is a stop defined as somebody riding it, or is it just as a stop, whether somebody gets on or not?
A stop is when they stop to pick someone up. Like if they go to the library, to the laundromat, to the grocery store, it's each
But they're actually
stop.
picking somebody up. It's not just a stop that's scheduled.
So we have no routes.
Okay,
So yeah, it's someone
it's
would
actual
call,
ridership.
Nick would call and say, I want to go to the grocery store and the doctor's office. It would be 2 stops.
okay. I just wanted to clarify if that was just a skewed number or if there was it's actual ridership.
Mhm.
Thank you.
Mr. Kopish?
Yeah, I don't recall, when we started the BART service, did we start in Phillips and move to Park Falls or the opposite? The opposite, Park Falls
Park
was
Falls
first and then
first,
Phillips?
Mhm.
It just seems like it just hasn't taken hold down here as much as in Park Falls. Is there?
We've talked about that a little bit at the TCC and then just Pat and I. It is a different demographic during the day in
Yeah.
each one of the municipalities. So Park Falls tends to have a lot of day riders that are going to the grocery store, going out to eat with friends, going to the library, going to the doctor's office, or having the hospital there is a higher ride rate. We're down here, we're during the day, it's a lot of manufacturing, a lot of businesses, so it's not the same ridership. So that's probably the biggest thing. And then the schools have bought into it up in Park Falls, so that's a lot of rides. A lot of families have for like swim lessons in the summer, sport, not what do they call it? Not practices. So when football practice starts in the fall, kids can ride from home to the practice for $1.50, $3, whatever it is. So the parents don't have to leave work to go get their kid to the practice.
How much has the vets using the?
Yeah, the
I imagine
vet-
that's in these numbers too, right?
Yep. So the vets, we're the largest county. So it's Ashland, Bayfield, Price County, a little bit of Washburn, but they do free rides for vets. We had 600 of some rides in the first 6 months, where like Ashland had 2. So
Wow.
the free rides for vets is a huge.
I thought it was a big deal. Yeah. Thank you.
Okay, so under the Aging and Disability Unit, first would be Guardianship Protective Placements. So you can see our numbers there, numbers of referrals, and then new guardianships. and then also the protected placement reviews that we do on an annual basis. And then we did have 2 emergency protective placements in 2024. Any questions about any of that? Okay. So then the Alzheimer Family Caregiver Support Program and the National Family Caregiver Support Program. There were 3 participants served under the Alzheimer Family Caregiver Support Program and 8 served under the National Family Caregiver Support Program. So each one has 8 slots. So the National Family was full, but Alzheimer's was not. Any questions? Okay, so moving on to the elder adult at risk. So you can see from the whole page, the population that we serve, the different types of abuse, self-neglect, and financial exploitation are by far our most frequent referrals. Financial exploitation is just exploding across the entire country. And is really, really a concern nationwide and around the world. Any questions on that? Okay. And then we have the Aging and Disability Resource Center. So you can see the number of, at the bottom, right there, the number of referrals, screens, and all of that that were done. Those are pretty similar to last year from what I could see, or the year before, I should say, from what I could see. And then on the next page, we have the elder benefits specialist, the disability benefits specialist, and the dementia care specialist, and the number of residents that they served. Any questions on any of that?
Yeah, just a question on the whole family care issue. You know, we used to have our own outfit here in the northern part of the state, and then that got changed. Do you know where this is all being, how this is all being handled statewide? Is it one organization that deals with it? Because the ADRC supported that effort, I believe. Am I correct?
So different organizations
yeah.
will apply, they contract out, so it changes from time to time. So it used to be Northern Bridges.
Right.
Yeah, then it was something else after that. Now it is Inclusa. So Inclusa, yep,
Okay.
Inclusa is still in our area. And then there is another one that is statewide called My Choice Wisconsin. So those are the 2 family care right now.
Okay.
Now, next time contracts go out, that could change again. And then there's also the IRIS program.
Right.
That is available in this area.
Right. So Inclusa, how big of an area does Inclusa cover now? The whole northern part of the state? Or?
Gosh, I don't know for sure, but I think it's a pretty large area. Yeah.
Okay, thank you. Because they had an office in Park Falls and that's empty. So they're apparently working out of their homes or something.
Most all of them work out of their homes.
Yeah.
There are a number of workers here locally that do live locally, but yes, they don't have a central office anymore.
Okay, thank you.
Okay. Anything else? And I think that's it.
Thanks, Dawn.
Thank you.
Okay, next is Children and Youth, Kayla Borgen.
Good morning, everybody.
Good morning.
Okay, children and youth, Child Protective Services. We received 477 total intakes. With that, if you look over at the child abuse and neglect, we received 225 referrals. The difference in that number is that sometimes we receive just information that maybe won't be documented as like a child abuse and neglect. Anytime that law enforcement comes in contact with a child, even if it doesn't have to do with child abuse and neglect, they send us those reports and we file them and keep that information in case it's somebody we work with in the future. So we do document all of those calls, but we did receive 225 child abuse and neglect referrals and conducted 93 investigations. 20 CHIPS cases were filed, and that's our formal court orders. We also serve them in other ways through voluntary services or child welfare, that kind of thing. But actual formal court, we would have taken 20 cases to court. Next program is Promoting Safe and Stable Families. That's a grant funding program that's been around forever and ever before my time. We served 42 families, 67 children. What that program serves would be like, we have some part-time employees that will provide like mentoring services or respite services or safety checks for our families. We take that out of there. We help provide families. It's kind of a flexible funding a little bit. There's 3 different outbreaks on it. There's reunification. So if we're doing some service to a family that's working on getting kids back home, we can use some funding for this out of this program. And family preservation, which would be to keep children in the home and provide services that way. And then we also had the gift program. Currently, we don't have anybody in that program, but that's growing incredible families together. It's a program for first-time moms that need help just with ages and stages of development, bonding, just kind of learning the new parent role. Young parents, it can serve anybody, but that was the population we were serving. The TSSF, Targeted Safety Support Funds, that's the one that I've talked about lots of times with, we use it primarily for emergency funding. I think I've talked about how it really is a huge program. It's a grant funded program, but we use it to for really, really this child's going to be removed if we don't do this. And we've been able to be creative in providing hotel stays or housing, paying for a couple months rent just to help them get back on their feet, to help them find a job somewhere. Household supplies. I think we've talked about it lots of times about buying a washer and dryer, and you don't understand how essential that is to keeping kids safe. So that's that program. We served 8 families and 17 children. Let's see here, youth justice. We served 70 children. So 70 referrals were received regarding youth justice. The next couple slides are kind of just a breakdown of the months that we received the referrals and then breakdown of the ages of the kids that we served. There's with youth justice, there's a breakdown of delinquency referrals and juvenile in need of protection or services. I think we've talked about that before. If anybody needs clarification, let me know. But it kind of tells you the kids that we've served there on the next page. In foster care, we still have only 6 foster homes. We are struggling to recruit. Jasmine, we had hired a part-time. She works 27 hours a week. And she's staying pretty busy with that. We have a lot of kids that are going to families now, and there's new changes with kinship care and family find. And so she's doing a lot of work to do home checks on them, do home studies on them, get families licensed, but those families aren't necessarily wanting to be foster parents. So we're going to set up some time in October. She's got some things she wants to get accomplished here in September to try to see what we can do to get out on the radio or do some creative things to see what we can do to recruit foster parents. Right now we only have 6. And then the next page is the out-of-home placements. 30 children were in out-of-home placement in 2024. 15 were placed in the county. 15 were placed outside of the county. 66% of our out-of-home placements are drug-related. And then it gives you the breakdown here of relative court-ordered placement, foster care, voluntary kinship care, treatment foster care, residential care centers, subsidized guardianships, and group homes. And then again, the ages of children that were placed in out-of-home care, and then what the costs look like range from here in for the different types of out-of-home placements. I do believe that kinship care has gone up to $375. So it says 300, but that moved up to 375. And then foster care subsidized guardianship, I believe that 420 to 1,000. It's not 42. So I missed that. Sorry. And that's everything from children and youth.
Kayla, I have an observation that maybe you can confirm. When looking at on page 36, the types of placements for the out-of-home placements, it was interesting that your numbers are higher from I'm sorry, I've lost my place here. Where's that one with the numbers here? That, oh, here, the youth justice, I'm sorry, on page 34. So the referrals by month. So January through May seems to be your highest ones. Interesting that I found in the school district that they were higher during that time too. Is that stress related from school kinds of things coming to the end of the school year?
I think it's behaviors that are in the school, probably, you
Mhm.
know, so if the kids are out in the summer, they're maybe not getting caught for the things they're doing, or they're mouthing off to a teacher, or they're being disorderly or something in the school. So I think it's directly related to the referrals we probably receive
Yeah,
there.
that's kind of what I thought when I saw it. Oh, this kind of looks familiar, but in a different
Yeah.
screen. Thank you.
Yeah.
Thought it was just spring fever.
Yes,
And
that's,
that's, well,
we always amp up here in September, October, I think, with Child Protective Services as well. Those historically are pretty busy months, so.
I know you mentioned there's only 6 families, foster families. How many do you think are risk?
Well, it would be nice to have, I guess it would depend on the foster parents' like expectations, you know, if they're fine with staying vacant and just being open and ready and available. We don't have any families up in Park Falls, so it'd be nice to have like one family up in Park Falls, because otherwise the kids up there were sometimes taking all the way down to Ogama. So I would say like one more up there. We could definitely use 1 or 2 more in Phillips, and then maybe one down towards Ogama Prentice area, in addition to what we have, because the foster homes that we have right now at 6 are full. I mean, we can scrounge by sometimes for them to help us like for the weekend until we can find a different option or something. But right now, to say that, well, we have a couple options, but we have to be pretty creative.
Question, Sarah,
Good.
how are you on staffing? Are you fully staffed?
We have one opening, yeah, for social worker position.
Okay, that's been ongoing, hasn't it?
Yeah.
Yeah. Comment on the last page also, when you look at those out-of-home placements, that 66% drug related, that seems like it's a little higher than it has been, or am I misreading?
I think so, if I remember correctly, like anywhere from 50 to that 60
Yeah,
range, I think it
yeah.
stays right in there.
Yeah.
And I think we do count, like, that doesn't necessarily mean that like at that moment, there was a drug raid and that's why we removed the children. I mean, that does happen a lot of times, but it could also just mean that like, we know the family's struggling with that on top of whatever else is going on at the moment, so.
Yeah. And the referrals on that page 34, definitely when you get into junior high and high is when you're having most of the issues. Yeah.
Mhm.
Mr. Brodka?
So does the lack of foster care families affect our high placement costs? So if we don't have places to put them for foster care, does that go to our long-term issue that we're having with high placement?
Definitely can and has in the past. I would say in 2024, no. I don't know that in 2024 we placed anybody farther away or outside of the county due to lack of foster homes. I mean, we definitely are always at risk. There was periods of time in the years prior that it was like, oh my gosh, we're going to spend the night here with these kids, because the neighboring counties aren't always willing to let their foster homes go. I wouldn't either, honestly. But I wouldn't say in 2024 that was a result. It has been in the past. I think we've talked years prior about if we used a foster home, they were gracious to let us use a foster home in Taylor County, and the workers, I was one of them, we were taking turns getting up as early 6 o'clock, running down there to get the kids to bring them back up to their school and back. And that takes a ton of resources, of course. And then babysitting the kids that didn't go to school during the day and taking shifts and turns in there. So that was kind of a big deal. But right now, no, I don't think that we have kids placed farther away than they need to be or in a higher setting because of lack of foster care.
Okay.
And
And
I
I
would-
was just a thought that if we need to relook at how we're funding our foster care program to alleviate some of the higher expense stuff.
Yeah.
Just a
Yeah,
thought.
no.
I wouldn't say it leads to the high cost placements that you're thinking of where it goes off to a facility. I think it more is staff resources and overhead costs, where like Kayla's example is, okay, now the children are located in Taylor County. We have an extra 4 hours of staff time running them back and forth, plus they're out of their own home. That's where those costs of not having foster homes is. the high cost placements are, I wouldn't call them last resort. They're beyond that level. That's where it's just high cost because it's a
Residential,
bigger,
yeah.
bigger issue.
Yeah, treatment foster home also though is pretty expensive. And if we didn't have, that would be just, but I know you're talking about is the high, but also we have those treatment. If we don't have a local, we might have to go to a treatment foster home, which would be expensive.
Yeah.
Yeah.
And I would say that in the years prior to, like, I remember kids that we didn't have foster home for, so we were looking in the Eau Claire area, which they would have been an excellent foster home, but it was a treatment level foster home like Sarah's talking about. In 2024, no, but in years prior, yes, there has been some issues with that.
So to incentivize fostering it, I don't know if we're at that point. I know the state continues to work on it as one of their priorities. So they changed that was it in 2024 that they redid the like respite care amounts, and there was something where they did try to alter the costs that families were taking on less burden because things were getting more expensive.
I do want to remind everyone on the committee and whomever else is listening out in the airwaves that, you know, Kayla talks about having to get up early in the morning and making sure that those children are bused or car driven to maybe up to Park Falls from where they are maybe down in lower part of the state, county, that our managers are family. They have family too, you know, so not only did Kayla or anyone else have to do those kinds of things, then they have to book at home to make sure their children get on the bus and everything. So we have to remember that it's not just what you're reading. There's a lot of interactions that affect everyone, and that's where the stress level comes. And when you read through this, it's not just the managers who have gotten up to speak. It's all the workers and the other staff that are there. When you read through all of this, it's just mind-boggling that counties go through this. So we will truly support you as best as we can. And I think everyone agrees with that. Thank you.
Going back to one comment you had asked about staffing for social workers, we did start a program, what was it, 3 years ago, where we hired individuals that had the minimum educational qualification to go get certified. And we've had 3 do that.
Yeah.
So that's been a huge help that we assisted in getting their certificate. They've stuck with us. I don't think anybody that has gone through that program has left, right?
Right. I
'Cause
don't
we've
think so.
had 3. So those little things, it take 2, 3, 4 years to see results, but it has helped recruit, retain, make sure we have the staff to do the job.
Yeah. And a couple of them, somebody was just mentioning that have been like interns too. So that's been helpful. Get to try them out a little bit ahead of time and see if they're going to be a good fit for this. So that, and I think 2 or 3 of them have been people that have stuck with us. So that's been helpful too.
So you're all appreciated. I can say that for everyone here. So thank you all.
Thank you. Thank you.
What's next? Maybe we're talking. All right, so now we have, let's go back up to the vouchers. Thank you. I have it highlighted. It just wasn't looking. All right, everyone has had the vouchers gone through. You've had a chance to look at them. I'm looking for a motion to approve.
So moved.
Oh, Mr. Kopish.
I'll second that.
Mr. Bratka seconded it. Are there any questions? Okay, hearing and seeing none, I'll call for the vote. All those in favor? Those opposed? Okay, motion's carried. Thank you, Chrisanne. Did you get the paperwork? Okay, good. Thank you. All right, annual reports there. Now we are down to the TCC transportation. We're going aging and disability senior services, and we have, what am I missing? Oh, public health. I'm going past you, Tiffany. You were up here before, so here you go. Come on ahead. I already had her marked off. Sorry.
All right, I just wanted to present and our fee schedule. It does say on the agenda, the public health and reproductive health. I presented the reproductive health one last month and got approval for that. So this is just our standard public health fees. And I would need that to be approved by the board in order to implement. So I'll explain what we've done here. So the top ones here, you can see this, some of the changes, or what we're proposing in red. For our administration fees for our immunizations, we had them at $20. We're requesting up to $25. We ran our cost analysis for 2023 and for 2024 on our immunization program. And it showed that what it should cost for our administration fee would be about $23.25 if we average those 2 years together. So we are proposing go up to $25, because we are seeing an increase in the cost of our supplies, as well as we were trying to be strategic in using a lot of the supplies that were left over from COVID vaccination, but we are seeing those are expiring in the end of 2025 and going into 2026. So we're going to have to order more supplies in order to provide immunization. So factoring all that in, that is our proposed request. Venipuncture, you'll see we're requesting to go up to $20 for that. Same with needing supplies. It's not going to be as high as the immunization cost, because we do get some of the vials and things like that. We get that from the state themselves, so that it brings that cost down. The laboratory costs here, that is based upon the dollar amount that this Wisconsin State Lab of Hygiene gives us. So this is just what it costs. There's nothing we can do about that. And then we are removing the vaccine administration fee for the state supplied vaccines for those 19 and older. That is state requirement. They had changed the program in order for us to get the state supplied vaccine for those individuals. We cannot charge an administration fee for those. Those are what we call our VFA program, vaccines for adults. So those would be those that are uninsured, underinsured, that would receive those. Anyone with private insurance would be recommended to follow up with their primary care provider. And then down further, the vaccines that we have listed, you could see how we wrote that in red. Obviously, our influenza, we are in our COVID, we are waiting on state guidelines for that, to know what we can do with that. Our supply is coming in. Once that supply comes in, we'll know the cost of those vaccines, and then we will include that administration fee, and then we'll have our final price for that. So are there any questions on what we're proposing for cost?
No questions on the fees, but I do have a question. If we get, once we get done with this, if you want to take action on it, why don't you do that? And then I got a question.
Okay, so if there are no questions regarding the fee schedule, I'm looking for a motion to approve. Mr. Wartko, anyone to second?
I'll second.
Okay, Ms. Kolwicki. Any discussion? Okay, seeing and hearing none, I'm going to call the question. All those in favor? Those opposed? Okay, motion's carried. Okay, do you need a
Okay,
signature or something? on
okay.
that? Do you need a signature for that or anything from the board?
I think we can just go ahead and it will be in the minutes that it's approved
Correct.
for this fee schedule. So we'll take it as that. If that's
good.
okay.
All right, Mr. Kopish.
Okay. There's been a lot of publicity this week because there was a Senate hearing with Mr. Kennedy. And coming out of that, there's a lot of people saying they can't get COVID shots. Would you explain that issue? Is it really that it can't get them, or has the process changed, or do they have to pay for them now, or what's the issue here? Because I don't understand what's going on.
Yes, I understand. There is mixed information. We have not gotten our guidance from DHS yet, from the state, to tell us exactly what is going to happen for us. In earlier information, the state was telling us that we would continue on supporting COVID vaccine for all. I can't give you an answer because we are getting phone calls on that. It is getting frustrating. We are waiting on state guidance to say exactly what we can and cannot do and for those state orders. So at this time, that is all I can provide. I do know that there are some concerns with it being 65 and older, and those that are younger than 65 needing a doctor's order to say that they have an underlying medical condition. I don't know where we stand on that right now as far as the state of Wisconsin telling us local public health departments because we're waiting on their final word. And I'm sorry, I wish I had the magic 8 ball
So we're in this period between something changing and finding out exactly how you deal with it.
Exactly.
Yeah.
Much like when we were in the pandemic and we wanted to be able to know exactly how to move forward and we're kind of waiting. This is exactly kind of that same anxiety that we have at this
Yeah,
point.
there's a lot of anxiety. Yeah. Okay. Thank you.
Yep.
Yeah. Did you listen to that hearing, Bob? Did you?
I listened to parts of it. I didn't hear the whole thing.
What Kennedy said was that if you're under 65, it's not recommended that you get the COVID shot.
Okay.
He says you can get it,
Okay.
but if it's not recommended, you're not going to get it.
Okay.
That's what the deal. That's
Does-
what the issue is.
And recommended means a doctor recommends
I
it? Is that
suppose.
what it means? I don't know.
Well, you can't just walk into the
Right.
to a like a well, not so much a clinic like Walgreens or something like that and get a COVID shot if you're
Right.
under 65
Okay.
because it's not recommended and they won't give it to you. That's where the issue is coming in. He claims you can still get it, but they're saying no, nobody will get it if it's not recommended.
That's what the issue is
Yeah.
people thinking they just can't get it.
Right.
But I didn't believe that to be true, but I don't know.
Well, try to find a place that'll give it to you.
Yeah.
That's the
That's
issue.
the issue.
Yeah.
Yeah. Okay.
When we have our state guidance, if it's appropriate, I will email the board so that they know what the guidance that we're receiving from the state. If that would be appreciated, I will most certainly do that.
That'd be
It'll
good. Thank you.
also be communicated to our community as to what stance that we will be doing from the state.
Thank you. No other questions? Okay, thank you. Oh, Tiffany, wait, you were going to tell us something about a nice little perk for our northern area.
Yes. So one of the perks, I can go a little bit off of Dr. Daly and saying supporting public health, especially for our northern area. If any of you recall or remember Becky Birchmeyer, she works for Aspires Clinic, is in a leadership position. She had reached out to our agency looking for representation for the Northern Public Health region. And I will be joining a panel down in the Dells that's going to be for some of the hospitals and discussing the collaboration and what needs to do for access to care and what it means to be public health and what public health does and work on that relationship.
Great. Well, now we'll have a voice from the north. So thank you for doing that.
Thank you.
Keep us up on that. Thank you. All right, so let's go to number 6, Aging and Disability Senior Services. Let's see, we'll go with TCC Transportation Coordinating Committee report. Patricia?
Yes. We had a meeting on August 18 here in Phillips. We had the election of myself as chairperson. We had the election of Vice President Dixie Weideman. We discussed budgeting as normal. Of course, the price of materials has skyrocketed, and buses that used to cost approximately $75,000 now cost approximately $135,000, which is almost twice. A few years ago, BART ordered 3 electric buses, and none of them have arrived. The challenge is the company producing a newly ordered electric bus. The company is not returning phone calls or emails to us or to other counties. So something is going on, and perhaps they're reaching out to the Wisconsin DOT to intervene.
Yeah, the biggest problem with those were, in order to use the federal funds, it had to be made in America. And the problem with some of the materials is there was very few battery manufacturers that will get it to the level of 85% made in America. And every time there was one company they were working with, the batteries were being tested. It's called an Altoona test. And then that company went out of business. So then they had to go back and try to find different batteries. And so it's been a process is where those buses are not coming to fruition, was just that there's not enough people making the parts to make them available and then passing federal guideline tests. The other, with funding, budgetary funding, I did go to the council meeting in Park Falls to request $12,500 going forward. They were very receptive. Sounds like there'll be no issue putting that in their budget again next year. We're working on getting on Phillips' agenda to also request that $12,500. We've reached out to Butternut, Fifield, I think Town of Lake, to get on their agendas to ask for a reduced amount. There's coverage in those areas, but not their full area. We've had it's never been easy with those municipalities, because it's like, well, you only cover 10% of our municipality, so why would we contribute to it? But we are working on making sure we continue to fund that. It's a great program. You've seen the numbers, and costs do continue to go up. So.
Okay. Anything else? I think we're good. Our next meeting, I believe, is in November.
Okay, any questions for Tricia? Okay, thank you very much. Let's move on to Council on Aging. Chris Maybe.
So we had our COA meeting on Monday, just this past of this week. Some of the updates that were discussed. We're having a fall nutrition staff training day. It'll be held on October 1st in Hayward, so all the nutrition sites will be closed so that the site managers and all the subs can attend. They all need continuing education, so that will fulfill 4 of their 6 hours of continuing ed. I attended a nutrition director refresher training on August 27th in Wausau. And then I also went over how many meals were served in July and August. The average meal count for August was 44 meals in Park Falls and 8 in Kennan, and all the other sites fall in between. We again talked about the Senior Living Expo, which will be held Tuesday, October 14th, which we're excited for. Cheyenne, the community outreach coordinator, just completed the training for Mind Over Matter, and she's going to be offering a class starting September 25th. So that'll be held for 6 weeks. It's one time every 2 weeks for 6 weeks, and she's already received a few calls for that to sign up. So we're excited there. We're planning a fall color ride to Copper Falls. It'll be on October 16th. Initially, we started out as just, we were trying to hit a 3-year goal, a plan for social isolation, loneliness, and transportation. So by doing that, we signed out the van so we could take maybe 4 to 5 people. We're used to nobody signing up for anything, so we didn't expect to fill the van, but so we're up to probably 20 people right now. So we did reach out to BART and they will be providing transportation. We'll use the 28 passenger van. And then I believe we will have bag lunches provided by the cafe. It'll be a suggested contribution, just like the dining site meals. I did have a 3-year plan review with GWAR September 3rd to review goal progress, and then I just reviewed all the goals at the COA meeting. Our next meeting is December 8th, and that'll be in Park Falls. Any questions?
Did you want to mention that you're going to close the senior living, the sites on October 1st? Did you mention that?
Yes.
You did. I mean,
right away.
Okay, I missed that. Sorry, I was
Yep.
looking for my notes.
Yep, so they'll all be closed.
And then also looking at my notes here, did you want to talk about the veterans van?
Oh yeah, from the little I know, it sounds like the veterans are getting a free, through a program, they're getting a free van. And they'll be able to, they're looking for volunteers to drive this van, but then they'll be able to offer transportation to, is it Iron Mountain?
Right,
Only, right?
right.
So if the veteran needs to go elsewhere, they'll probably still come through us for transportation, but so that's kind of exciting for the VA.
Yeah, so that was through the VA. It's not a medical van, but it's medical transport. They had to choose which hospital they were going to use or which veterans clinic. So they chose the Iron Mountain one because that covers 85% of our vets in Price County. Those vets that aren't covered can work with Russ County, Sawyer County, and Taylor County. If, like your volunteer driver isn't available, they can work with that group. But yeah, so in the past, the vets would contact your office to try to get a volunteer driver. Now they'll go through the vet's office. The van's 100% paid for because it's actually given to the hospital, I believe. And then they give you a credit card for all the expenses through the VA. And then any fixes they do too. So it's a little bit more work in our vet's office, but then it's a little less work in your office to schedule those rides. So it'll be a
But
good
they'll
program.
need volunteer drivers for the van.
Yep. And I don't know if it has to be a veteran that's the
I
volunteer
don't think so.
driver.
I didn't get that from Dave Schmidt. No,
Yeah,
so-
I didn't.
Yeah,
either.
so they just have to pass a background check through the vet's office.
Okay, any questions?
What was the date of that senior expo? Was that this,
October 14th.
October 14th? I thought okay.
Yeah, if you get a chance, I think it'd be great. It's from noon to 6.
Correct.
Right, so
What day of the week is that?
Tuesday.
Tuesday?
Tuesday.
Last question. Is the committee chair behaving himself? Because if he's not, let me know, okay?
On the COA, yeah.
Well, you already know the answer to that.
Okay.
Any more word on the AEDs?
Yes, it's been the batteries. It sounds like it's a new machine there. Yep. And I asked about the fire extinguishers, and there's somebody that comes around and checks them periodically. So
But you were saying that it wasn't checked in Brantwood, is that what you were saying?
AED and Brentwood, they say the batteries are dead.
yeah, and I talked to Sally just last week and this week again, and it's been all replaced. So.
Okay, good. Thank you for being
And then the
here.
other sites,
Not all of them have AEDs.
no, I know that.
Yeah, and it's not required from our standpoint, so.
You could probably go to the town board for that. Of those buildings, maybe. It's a thought. Okay, any other questions?
We talked about that we might have some money somewhere, but I guess not.
Oh, shoot. Okay.
Okay.
Any questions for Chris? Any more? Okay, thank you, Chris. So we have 6C, and that's ADRC Governing Board. That would be Dawn and myself. Dawn, if you want to come on up, and then I can just mention things if you don't usually miss stuff, so I'm not too worried about that.
Alright, so ADRC governing board, they reviewed the financials year to date, and everything looks kind of in line with what the expectations were. There was nothing that stood out. And they did approve the 2026 budget. So there's been a slight increase in funding from the state for ADRCs. It wasn't a lot, and I don't know that I recall off the top of my head, Paul. I don't know if you do. It was 30-some thousand, was it? Is that correct?
I think 26, 27, is that what I see?
And
Oh, there we go. All right, so, yeah, so anyway, there was this increase in state funding, so they're using the same formula to distribute that to the counties that they use for the contract allocations. So Price will get a slight increase in the amount of money that the ADRC receives. And all the counties did receive some money. So they also decided that all of, in the past, they kind of rotated the in-person meetings through all the counties, and they have decided that they're going to hold all the in-person meetings in Ashland. So all the counties will continue to join by Zoom or Teams or whatever it is they're using. So that was another one of the decisions. And gosh, I think that was about it. Anything you have to add, Paula?
Something I was pretty excited about is that we finally have one representative from
yeah.
Bad River.
Yeah.
We have 3 of the reservations up there on our board to be in Bad River, Red Cliff, and LCO. And it's just been a struggle to finally get a representative. So we had William there. I didn't gather his name real quickly, but he is there from Bad River. So I kind of just said, maybe he could do a little nudging with the other ones. It just would be nice to have representatives from them as well. So that was exciting
Absolutely, yes.
news.
Yep.
Thank you. Any questions for Dawn? I thought it was interesting that the caregiver watch they talked about, it's some kind of program that they have with ADRC. I didn't catch it. All I know is I did catch the title of the movie that you could watch. It's Wine, Women, and Dementia.
Oh, yeah.
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 I thought,
Yeah, I think that was Sawyer that did that.
Okay,
if
Sawyer.
I'm right. Yeah.
all those really important things to write down. No questions for Dawn? Okay.
Okay.
And Dawn, I'd had them put the next one right up because you don't have to go back and sit down.
Okay.
And that's the Woodland Enhanced Health Services Commission report.
Okay. So, the Woodlands Commission, there was a lengthy discussion about Medicaid reimbursement for nursing homes and the fact that Medicaid is not reimbursed at a rate that covers the cost to run nursing homes. So there was a lot of discussion about what they can maybe do for advocacy, contacting the Human Services Association, County Association. There was a lot of discussion of what they could possibly do for some advocacy for an increase in reimbursement, contacting politicians, so forth, because it just simply isn't at a level that it funds the cost of running a nursing home anymore. And so there was a lot of discussion about that. They did do the 2024 budget review, and that turned out to be a pretty good year. I think at the end they had a loss of like $13,000, which I guess is pretty good compared to what it usually is. So that was a good year for the Clark County Healthcare Center. And then for 2025, things are also going pretty good with the budget. And at this point, they said they have a $4 million surplus, but they said don't get too excited because there's still a lot of adjustments that need to be made, a lot of things that need to be counted in, but so far it was going quite well, I guess. And part of that was the fact that they have about half the number of contract employees that they had the year before. So that was great because that is a huge cost saving in staff because they're getting more local people to apply. They're able to hire more local people for positions, and they don't have that huge cost for contract employees. So that was a big thing. And then
They did the rate setting for, so the census update, when they did that, they had not included Price County because there were more recent placements, so I just wanted to update and did include had sent an email to the accountant over there and had included Paula on that because I just wanted her to know that it wasn't correct what was at the meeting. So we did have 2 placements at Clark County in June and July, and then 1 placement for the first couple of weeks of August. Okay, so then rate setting for 2026. So the daily rate that we pay, that's the add-on rate for people on Medicaid, that went down $10. It was $90 last year or for 2025. In 2026, it will be down to $80. So that rate was agreed upon, and that will be the rate for 2026 for that Medicaid add-on. And then they did talk about a subcommittee, and I know Paula volunteered to be on that, so we will have a voice, which I think is great.
Well, they needed somebody from the north, so it was like,
and I think that what they're talking about is Clark County has like a $2 million tax levy to cover Clark County Healthcare Center. So they were talking about looking at the assessment rate and seeing if that is a fair distribution amongst all the counties in the Woodland Commission. Do I have that right, Paula?
Sounds pretty good, yeah.
Okay.
I didn't write it down, so I'm pretty sure you're okay with that. Sounds good.
All right. So that is about all I had jotted down. I don't know, do you have anything to add?
No, actually, you covered it very well. Unfortunately, I logged in and I was on and I had it going and we went through a couple of things and then suddenly my screen froze. So after a couple of attempts, I logged out and then I went back on by the phone. So I had asked Brandon to send us the minutes, but he's on vacation, so I didn't get those. So, but
Okay.
you did well.
All
Thank
right.
you.
You're welcome.
That's why it's nice to have a couple people there in case there are glitches. Okay. Let's go to number 7, Kayla for Children and Youth Unit and Juvenile Justice Report.
This should be short because I think I already went through it. Sorry, in my first one. So I don't know if in reviewing this, if anybody has any questions, really. I won't take up too much of your time. Sarah?
I was just gonna say that, on the back 2 pages, it shows the crimes. That's not, in the annual report. And normally this report does come out earlier. It's just unfortunately, we, didn't have it prepared earlier. Usually it comes out in March, so. But that would have been added.
Can you find it? Any question? Bob, you're kind of shrugging.
The back 2
Oh.
pages, it's juvenile offenders types of crimes.
There's two separate.
The juvenile offenders in Price County. So if you look in that back,
Dispossession of offenses.
okay, so then if you go back, yep, keep going,
There's another page.
The 4th page.
Crime.
Crime.
There you go.
that, the crime.
The crime.
The crime.
The right way.
Yeah, so that's not included in the annual report, so that's just additional information.
Any questions for Kayla if you had a chance to kind of scan it? I mean, we can always ask her next month if there are any really concerns that come up. Okay, thank you.
Thank you.
And then we have Carrie coming up with, oh no, Sarah, you're next. Economic Support Unit, Sarah.
Steve.
And Steve. Steve is our Northern Income Maintenance Consortium Administrator, Steve Butnick. Hi, welcome here.
Hi, good morning. So my name is Steve Budnick. I'm one of 11 Income Maintenance Consortium administrators in the state, and I'm the voice for the Northern region. I like to say that I did not win the Powerball, but I won the career lottery because I truly love what I do. I know that that's kind of a cliche, but the services that we administer are very empowering. So I just want to speak a little bit about income maintenance before I get to the resolution and the purpose of why I'm here. So we are a 12 county consortium. So we work together collectively to administer public assistance. That's food share, which is food stamps or SNAP, state Medicare, and child care assistance. We just have south of 60,000 cases in our consortium alone. So our caseload is very diverse. It's everything from prenatal services to members that are in the nursing homes. So every single lot of life in between. Some of our customers are homeless. Some of them have been living in the same house for 60 years, and they just need some supplemental support to get through the daily life and those medical and food essentials. We serve people that are college educated, veterans. We have customers that are employed, customers that are underemployed. Sometimes we have even substitute teachers, firefighters. I mean, it's a litany of different types of customers that we serve. I always like to present that when I speak in front of boards because sometimes there's this image of someone on public assistance who's maybe not working and they could be working, et cetera. And that is the case sometimes. But when you have 60,000 different cases of Wisconsinites in the 12 counties, it's really diverse. So I just like to put that plug out there, especially as I segue into the resolution. One thing I do want to also mention about the impact of our programs that we administer is, in addition to getting food share, which is what you buy food with at the grocery store or wherever you get your food needs, and then the medical services, there are some additional perks to being involved in income maintenance for these county residents. One of them is that if you are eligible for food share or food stamps and you go to school, you're automatically eligible for free or reduced hot lunch. So that's a big benefit for our schools. Another one is that we make referrals to community resources such as energy assistance, the ADRC, et cetera. So they work with a live employee that kind of assesses their situation and identifies that we can help you with these services, but there's also these other programs that you might be eligible for. One of them being the transportation program that I know somebody spoke about. Our income maintenance workers will make those referrals because through conversation, they may find out, I don't have a ride to pick up my prescription. I don't have a ride to go to dialysis. And then that's a great segue. So they're more than just data entry operators. They're really case managers, and they're really those beacons of those referrals and that support for the county residents that we serve. So segueing to the resolution that I know is in your packet, this was brought forth by the Wisconsin Counties Association. And what we're asking is counties to have the support to send this out to provide additional funding in the future. We know that with the federal bill that was passed, it is going to impact human services, and specifically for income maintenance. If you go to the 6th whereas, it's going to reduce the match from 50% to 25%. So that's quite significant, and that's going to occur starting in 2027. So the state of Wisconsin is asking for the counties to kind of move the needle and ask for the state to provide more financial support through GPR so that there isn't a burden to consortiums, there isn't a burden to the cases and the customers that we provide the support to. I also want to just mention the 5th whereas, one above the one I just referenced. It says that after a certain threshold of worker errors, the state will be penalized on a monetary aspect. So this is something that is new, and this isn't something that we can control. But what we can control, what's in our court, is for the northern income maintenance, where Price County is a part of, we've already implemented some parameters to reduce our worker errors, and we are a top consortium. So we're not too concerned about the worker error element. Certainly there will be room for negotiation if they look at the state together. meaning that if Northern is compared to like Milwaukee, who has the highest worker errors in the state, that kind of brings an equity conversation. That's down the road. I certainly envision some additional conversations surrounding that. But right now, I do want to just be transparent that within the bill, it does say that states will have to kind of have skin in the game and have a financial piece to when there's worker errors, when they administer food share benefits. If you're thinking, what is a worker error? It could be something as a clerical error, meaning that they entered it in wrong, or maybe that the system, they didn't read the system properly, so there's training components to that. If we're found to have our cause is the reason why someone got more food share benefits, that's what's considered a worker error. So we are, as I mentioned, one of the top performers in the state, and I anticipate and also expect that we will sustain that. And so I'm not too concerned from an administrator standpoint on the worker errors. My main focus, and Sarah invited me to speak on this, is the support that we're asking for the counties to have the state of Wisconsin offset that 25%, because that's significant. In the northern counties together, that's over $1 million that the 12 counties would have to come up with. Before I open it up to questions, I do want to just mention that this is similar to the resolution that you passed about the SNAP education and FoodWise. What's different about it is that the proposal for the resolution on the table is for the administration of the income maintenance programs, whereas like FoodWise or SNAP education is more or less for a highlighted abbreviated version is providing additional or supplemental support, such as nutrition advice, maybe a booth at a farmer's market, those types of activities that my workers don't do. They are the primary eligibility factors in the benefits. So they don't go and do like outreach efforts. So any questions for me?
The floor is open. Nick?
Yeah, I just want to hit again on that where you're talking about the difference between the one we've already done and the one you're working on, because we as a county passed one last month for the education.
Right.
This one's doing with the funding, which we were aware of that in 2027, it may be a fiscal or budgetary impact. So bringing this forward is where we're working for being aware of 2027, 2026, everything, I guess, stays the same. And we're just working towards that 2027. If there is you outlined it, what, $1 million for the 12 counties, depending on how they distribute that. If it's evenly, that's quite a bit, 90,000. If it's based on population, maybe we're down to 60 versus some of the surrounding counties, but there will be a potential fiscal impact if the state doesn't come up with additional funding.
That's 100% correct.
Any other questions, comments? Mr.
No,
Cohen?
I'm just glad to see we're asking the state to step up, which is what we did with that other resolution.
Right.
That resolution wasn't initially written that way. It was like whining to the feds about, and that's not going to go anywhere. So getting the state involved with some of this stuff, I think is a good way to go. So
And that would be cited on 4950.
that's the first
through
whereas, or
52,
now
yeah.
therefore be resolved. Yeah.
Yeah, that the County Board of Supervisors urges the state of Wisconsin to provide funding to offset the county fiscal impact caused by the enacted federal SNAP changes and to work with counties to ensure adequate resources for the administration of food share and related programs. And then you can read the rest. So we're just asking for their support.
Right. We're to go with that a little bit more is we're saying to the state, we need your help if something doesn't happen. The state is actively, and NACO and all of them are actively working at the federal level to say, whoa, some of these changes they're not going to be good for the states. So how do we, I don't want to say backtrack, but how do we reevaluate and say we need funding at the federal level? So we need to support the state. The state needs to then support themselves by going to the feds and saying, we need help.
So is this only coming from us, or are we sending it on to County Board again?
This will go to the
County
full
Board
county board.
because of that. All right. So if there are no other questions,
May I
Motion
just
for the
add
Juana
something?
County
I just thought
Commissioners.
of something that's in my notes. I do want to mention there was something discussed just recently about the federal piece. Wisconsin is the 4th in the country in terms of error rates. So we do have some political power when we have these discussions with the Fed decisions. So that is something that we can be proud of to be Wisconsinites, that we do have a very low error rate compared to our the other states in the country.
That is one thing. Do you want to, I know you kind of hit on error rate, but we talk a lot about that at like our administrators meetings or the state level. What really is an error? You know, you kind of hit on it where it's like, oh, they got a little bit too much or there's clerical. What we see in the media is like, oh, somebody like myself, I get all this extra stuff when I don't qualify. Is it qualifying issues? Is it, what do you see for the majors in a non-Wisconsin who may have a higher rate?
So it would be substantiated errors from a monetary element. So it could be that somebody put $40 an hour when it really was discovered that it was $20 an hour. So this is agency or agent based rather than client based. Because when a client reports inaccurate information, we do have a fraud and a navigator who will sanction a person for public assistance. They may have to pay them back. They've even gone to the degree of withholding someone's federal and state tax refund because they committed welfare fraud. So this is different from the client-based fraud. This would be like worker errors. And again, that's why we're trying to take as much proactive guidance as possible and training mechanisms to reduce and sustain a very low error rate. And Northern has been historically under 5%. So we're not necessarily shaking in our boots, but still we want to make sure that, because it could be, next month we have 10% errors. It's luck of the draw and what cases get pulled. Again, we're human. We are going to make mistakes. We're not robot services. We're human services. So we have to keep that in mind as we have these discussions. But I really feel like we're going into this with our ducks in a row. And again, I just ask for the county support to kind of move the needle from a state standpoint.
Mr. Kopish? Okay, make a motion?
Yeah, motion to approve.
Approve and,
Forward to the county board.
thank you.
You're welcome.
Seconded? Mr. Warco seconds that. So we have a motion to approve and forward on to the county board. And a second, is there any discussion, any other discussion? Okay, seeing and hearing none, I'll call the question. All those in favor?
Aye.
Those opposed? Okay, motion carries.
Is there
Thank you.
any reason that we would want to invite to the full board to discuss this, or is everybody comfortable with?
Well, it probably would not hurt. What do you think, Mr. Ernst?
I think it's pretty straightforward.
Okay.
I
so
don't
you
think
want-
we need to.
Okay.
If you're available, you can always jump online and listen,
Yeah.
and then if there's
But,
questions, so.
Sure, absolutely. That sounds a plan.
That's-
Committee members and myself being here, we could probably answer any questions.
Probably so, but if you're online, just in case.
It's next
Okay.
Tuesday at 9 a.m.
And you'll be
The
on.
link is on
Oh.
our county website, just to join the meeting. I make sure people can unmute if you're online.
Okay.
Thank you.
Thank you for
Sarah.
being here. We appreciate that. So I just want to, before you discuss something, I want to go back to the 2024 annual report. This is not something we need a motion to, but I just want you to know that it was an FYI and it'll be on file. Just an FYI. Okay? Go ahead. Sarah, I think you're up. No, Carrie. Carrie, come on up. Carrie Hammond, fiscal, yeah, come on down. For our high cost placement reports, you have those two nice little colorful sheets in your packet to which she will be referring.
Okay, yep, we have our high cost placement reports again. For children and youth, there's a little bit of a clear sky. There was 2 high cost placements that will be dropping off soon, that we are gaining another one. So we're saving maybe about 10,000 a month. So that does add up. So that's a good sign. For the behavioral health high cost placements, that one is below last year on that projected path. Again, those things can always change. Maybe something that's helped contribute to that, and maybe Sarah could say more if I missed something. But now behavioral health is fully staffed, and those workers are getting up in some of those other programs, like Trana had mentioned, the enrollment's getting higher. So maybe some of those are stepping in for some preventative things before it gets to that point.
One quick question that you said there's 2 high cost placements dropping off. Are you pretty confident?
We're
'Cause-
they're changing venue. So what's happening is the parents have lived in a county. Once they live in a county for 6 months, then they establish their residence. So that county is going to be receiving or accepting, but it doesn't sound very good of what's going to happen over in that county, unfortunately. But then we're receiving another counties for a change of venue.
Mhm.
So that's what's happened. So 2 of them, they won't be back in our county. So that is good. I mean,
Not so long ago, we had one
Yeah.
like that, and then they came back. Or
I know.
They never left. I'm
I
not
know.
sure what happened to them.
Yeah.
I just wanted to.
This one here, for sure, they've left. We went through the state in regards to residency because they were homeless. And so the state has helped us out with the 2 placements going over.
Good.
Thank you.
All right. Thank you, Carrie. Let's go to number 10, Director's Report. Sarah, you're next.
Last month, Patty had asked for what it's qualifying for the WEAP program. So I have given you guys all a brochure that gives you the income and family size of how they qualify for the program. So I believe that's what you were asking for, right, Patty? Okay. And these just came out. Probably not any questions on that. Next is I just wanted to give an update is that October 4th, 2025 through September 30th, 2026, that the average daily inpatient rate for adult services in Mendota and Winnebago Mental Health Institute will increase 10%. So they were at $1,580 to now it's up $1,756 daily. So that will take place. So I wanted to give you information on that. On September 24th at our all staff, we're going to have the active shooter. So Seth will be doing the active shooter. So he's going to be doing for the whole entire normal building.
Deputy Dabler. Seth
Yes, I
Dabler,
couldn't- I
deputy.
know.
He's a deputy. So if you don't know who Seth is a lieutenant. So technically not deputy. Lieutenant Seth Dabler of the Sheriff's Department will be doing active shooter for your department.
So all throughout the whole I invited.
True.
yeah.
The normal building.
So it'd
on
be the veterans, the
last
forestry,
Wednesday,
the zoning,
And then we'll be doing it here in this building.
October 29th.
Is that
No.
what we decided? We were at the safety meeting yesterday and we picked a date. So yeah, sometime in October it'll be in this. We have in the past done it for the full board. We haven't done it in a while, but yes, Lieutenant Dabler.
Yeah, I'm excited. I mean, he sounds like it's going to be an hour, almost an hour to an hour and a half program. So I'm pretty excited about that. And then on October 4th, the Harvest Fest Public Health through the Health and Wellness, they'll be setting up physical activities for kids. I believe it's from age 4 to 12. They'll be down at Lionite Park. And then also we possibly will be putting down there for like birth to 3. So if they have younger siblings, they'll have information on birth to 3, foster parents, recruiting foster parents down there. So that will be for the Harvest Fest. And then just for positions, we're pretty full, which is good. I know some of our workers, which I had mentioned, and what Shauna had brought up as my one big concern is that CLTS, that Children's Long-Term Waiver, she has 50 some cases, and other counties they are 22 cases. So I may be having to relook at something because it's getting pretty concerning. I don't want, like Shauna had said, there's a no wait list. I know that one of the counties did get reprimanded. A few counties did because they had a wait list. And so that's a cause of funding issues. So I'll probably be bringing that to the board soon, as I don't want to burn out a worker to ending up not having a worker at all. That would be pretty concerning. All right. That's all I have.
I have a quick question.
Sure.
You said Winnebago is increasing
10%.
10%. Is that something regulated, or does that have to be approved by the state or anybody, or is that self-initiated?
Well, and actually I was going to make a copy and I didn't for everybody in regards to it, for the state is reviewing it. Each year it says the department reviews and receives the rates charged for the services. So the state would be looking.
So it is
And it's a
regulated.
state, yeah, and it's a state programs.
I wouldn't call it regulated. I would call it like negotiated like, is it DOJ or DOC?
For
The state.
DHS.
Yeah, but I think one of those two also works on saying, okay, here's your rate. Do we accept it?
Yeah, yeah, this kind of gives pretty much a really good background in regards to it. So I wanted to send that out, and explains, and we do utilize them, so it's pretty concerning.
So I've asked her to just send it in an email to us so we can take a look at it.
Sure.
Okay, that was a great question. Any other questions? Well, seeing and hearing none, and it looks like you'll be out of hearing time, Mr. Baratka. Our next meeting is October 8th. Thank you, and this meeting is adjourned.
Thank you for the speedy meeting.
The speedy meeting, yeah.